Hey guys, I'm Dr. Tobisch with Whitefish Chiropractic. And this video is going to be another part of our Approach to Care series where we highlight and talk about some of the tools and techniques that we use here at Whitefish Chiropractic to give our patients the best care possible. In this video specifically, I'm going to be talking about structural taping, or how we can use tape to prevent movement and stabilize certain parts of the body when we need to. All sorts of things can go wrong in the body when parts aren't moving enough. We have too much tone, tension, trigger points in the muscles. We have all sorts of tools to restore that good movement. Maybe we'll get out one of these metal tools, do some instrument assisted work. Maybe we'll get out some cups, do a little bit of dynamic cupping to get the tissues to move a bit better. Or maybe we'll get out some dry needles and stick these into the trigger points to get those muscles to relax. When joints aren't moving well, we can mobilize joints. We can use the chiropractic adjustment to really restore mobility in those joints. So again, all sorts of tools to remedy those problems when things are not moving enough. But there are also problems that arise when things are moving too much. Oftentimes we get these sprain-strain injuries when things go too far, too fast. Imagine a time when you've rolled your ankle pretty badly. So we've got a pretty good ankle sprain. Well, you've rolled the ankle pretty far, we put too much load through those ligaments in the outer ankle, and now when you're walking around, the ankle feels a little bit loose. And each time you take a step, you stress those damaged ligaments again, and it's painful. So this is a perfect time when we would use tape to tape up this ankle, stabilize the area, so now when you're taking steps, the tape can take that load instead of those damaged ligaments in your outer ankle. This will give the body some time to heal things up before we push you into our rehabilitation phase. So now that we've talked a little bit about structural taping, next up I'm going to show you some common taping techniques that we use here at the clinic when we need to stabilize certain parts of the body. Alright guys, I'm going to show you a tape job that we use here at the clinic. We do this sometimes after somebody has just rolled their ankle to give them a little bit of stability here, or we'll also do it before sport to prevent somebody from spraining their ankle. Typically when somebody sprains their ankle, we're going to sprain these outer ligaments. So the foot's going to be in plantar flexion and then it's going to go into inversion. These ligaments are going to go a little too far, a little too fast, and then we've got a sprained ankle. So I'm going to show you how we use this tape job to hold the ankle in the opposite position to offload some of these structures or to prevent them from getting overloaded when somebody's playing sport. So I put a little bit of the tape on our patient already just to save some time, but the next step is we're going to take one of these little tabs of tape. We're going to lay it down right here. Then next I'm going to come back with this Luco tape, which is a strong strapping tape. We're going to use this to give the patient a little bit of stability in the ankle. So I'll start laying the tape down here. I'm going to come over, catch my tab, and then pull your toes up towards your face. Perfect. Alright guys, next up we're going to look at a tape job that we use for the low back anytime that we need to temporarily prevent flexion or rounding in the lumbar spine. This could be for a sprained strain injury, this could be for a lumbar disc injury, any situation where forward bending provokes our patient's symptoms, and we want to temporarily take that away to allow the body to heal itself. So Annie already has most of the tape on her. I'm just going to show the last step, which is taking away that range of motion that provokes her symptoms. So we'll have her bend forward a little bit until she starts to feel her symptoms in her low back. So start to round forward and say it's right there. All right. Well, then we'll have her back out of that just a little bit, and then she can stay right here. I'm going to lay down those strips of tape so that she can go this far, but the tape would prevent her from going a little bit further. So I'll take one strip here, lay it down. Perfect. So like I said in the first video, this tape is really strong. So now she can move a little bit, but once she gets to that point where she would have her pain, the tape will hold on and it'll stop her from going forward.